right, I think we're live. Okay, let me start from the beginning here. Alright, so my name is Gavin, and my topic was the study of isopropyl alcohol nasal inhalation for nausea in the emergency department, and this was a randomized controlled trial. That was the type of study. So just a little bit of background about this study, and the question, why inhaled isopropyl alcohol for nausea in the first place. Nausea and vomiting is a common reason for visits to the ER, and is actually, I think I read, around 80% of all chief complaints are something to do with nausea or nausea itself. So it's very much a reason to go to the ER, and it's very common. Also, previous meta-analyses demonstrated isopropyl alcohol to be more effective than saline at preventing post-operative nausea and vomiting. So just some previous studies have shown that this isopropyl alcohol use for nausea and vomiting is actually it's promising, and it's shown that it could possibly be some sort of therapy. This has also been shown to be safe in animal models in studies that were done in animals, so that's also a positive thing. And two more things that kind of go hand in hand. These isopropyl alcohol wipes, which you can see to the right, there's a photo of them. I think this brand is Webcall. They're relatively inexpensive, and they are very, very abundant in hospitals in general, but also in the ER. Kind of just a little side note, I work in the ER, so this was partly a reason to look at this study for me. I know we were supposed to do COVID, but I kind of made the mistake of doing this study by accident. Anyways, I do have a lot of experience with using these all the time with, disinfecting and wiping things down and equipment and stuff like that. So it's definitely a resource that's used quite a lot in the ER, and the fact that this shows promising potential therapy for something like nausea is definitely something to look at more. So the main question of this investigation, the study, was essentially how effective is nasally inhaled isopropyl alcohol at alleviating nausea as compared to nasally inhaled saline, which is, in this case, the placebo, and this was in the emergency department. Just kind of a little tidbit on saline. I'm sure you're quite aware of what saline is, but for anybody who doesn't know, it's just essentially water solution with salt in it. So it's a salt water solution, NaCl at a certain concentration. So it's the placebo in this case. A little bit about this study, just kind of like the methods and the main statistical measurements of the study. So a sample of adults with the primary chief complaint of nausea and vomiting were enrolled in this study. So these were people at the ER that were there for nausea and vomiting, and that was their main reason for visiting. These people were randomized and double-blinded in the study, and it was a placebo-controlled trial in an urban ED. So that was the setting. These patients were randomized to either nasally inhaled isopropyl alcohol or nasally inhaled normal saline. So essentially, the way that this study was conducted was, if you look to the right there's a picture of the resources that they used, the saline and the alcohol prep pads. But essentially they just took, sterile saline wipes that you might find at any hospital and had the patients blindly sniff these for potential therapy versus some patients blindly sniffed the alcohol prep pads. And the only really thing that would give this away is the smell. If you were to smell the alcohol on the pad before actually, sniffing it for the therapy treatment, that would be the only thing that might give this factor away. But otherwise, both the patient and the people that were administering this treatment were blinded, and they just had essentially a sterile wipe in their hand that they gave to these patients to sniff, and that was the way of blinding. So yeah, that's just a picture there. And then to continue this kind of about the study, The key statistical measurements for this study was that the patient nausea was measured with published 11-point verbal numeric response scales that were already set in stone. Like, this is a set scale for nausea from 0 to 11. And then as well as in conjunction with this 5-point Likert scale, which was another type of statistical measurement of nausea/pain. Okay. So this is table 1 in the study, essentially just patient baseline characteristics for each treatment group. This is basically a list of kind of the overview of both the variables and the demographics of the patient population. So you have, the age, the mean age, the sex, for isopropyl alcohol versus placebo, as well as the severity of symptoms for the initial nausea and initial pain on that VNRS, which was that scale from 0 to 11 that I just talked about. And then you had that isopropyl alcohol versus placebo for both those. And then as well as associated symptom frequency. As you can see, there's a list. It just goes by the VNRS scale for frequency. Of course, this study was primarily looking at nausea, but it's kind of hard to do this without actually incorporating some abdominal pain, things like diarrhea and headache, and then just to see how that kind of varies with these other symptoms. But essentially, they were looking at nausea and vomiting as the primary measurement. Let's see here. So this is essentially just the first page of results, like their statistical tables or graphs, if you will. I know this looks kind of like a very confusing statistical graph, but essentially on the y-axis you have patient nausea by verbal numeric rating scale. So that's that one VNRS that I talked about, that scale that was given to these patients so that they could rate their nausea from 0 to 11 on the scale. And then on the x-axis, you have patients, and you have on the left side placebo, on the right side you have isopropyl alcohol, and that does have 1 in the center, so that's kind of like the baseline time. And then as you go further to the right and the left, you have post-treatment, pre-treatment, and time after treatment. So you can see this kind of tiered structure where, if I kind of break this down a little bit more, all these little dots here, those little circles, that was the initial dose, the initial treatment, when they actually gave this inhalation to the patient, where the patient actually inhaled this wipe nasally. And then as you go farther to the right, you can see how they inhaled again and again after a certain amount of minutes. And these lines that are coming down from these little circles here, those lines coming down to the bottom of the graph here, that's essentially looking at how much relief they had on the scale. So the rating on that y-axis is the rating on the scale. So you can see, just visually, I know it's kind of confusing, but if you look visually, you can see how on the right side, on the isopropyl alcohol, for both nausea on the left side and pain on the right side of these two graphs here, you can see visually just how much more significant the nausea was reduced with the isopropyl alcohol versus the placebo. There's virtually barely any kind of lines that go down from those initial treatments at any time interval with the placebo versus the actual treatment of isopropyl alcohol. And you can see that for both nausea and pain. And then on the far left and right side of both of those graphs, you can see these wonky looking bars, and that's just the statistical measurement of confidence. So, yeah. So as far as conclusions go for this overall study, out of 84 study patients, 80 or 95.2% completed this study, and 37 actually received nasally inhaled isopropyl alcohol, and 43 received nasally inhaled normal saline. So it's roughly half and half, essentially. At 10 minutes post-intervention, median nausea verbal numeric response scale score was 3 in the isopropyl alcohol arm versus 6 in the placebo arm, for an effect size of 3 with a 95% confidence interval, so they can be confident in their results. Median satisfaction score was 4 in the isopropyl alcohol arm versus 2 in the placebo arm, for an effect size of 2. It's just a lot of statistical jargon, but essentially they're saying that the median nausea response, based on that scale that we talked about earlier, was much more significant. So I got less. It was a 3 in the isopropyl alcohol versus 6 in the placebo arm. So these patients are saying that they are verbally less nauseated with the alcohol versus with the placebo. And it is a confident, a very statistically confident result there with a 95%. So yeah, essentially the overall takeaway here would be that nasally inhaled isopropyl alcohol was found to be effective at increasing nausea relief in the emergency department in this population of people. So yeah, why does this matter? This therapy provides another cheaper option for those with nausea in the ER, especially in the waiting room. A lot of people that we see coming to the ER, before they even get triaged, they're possibly vomiting. They have to use this bag that they vomit into, or in worst case scenario, they don't do this, but this is a really easy way to help these patients out before they even get something like oral ondansetron or other kind of therapies that we typically use, that are drugs that are approved FDA through the FDA for treatment of nausea. So this is a nice way to kind of alleviate their symptoms, or even pair this in conjunction with possible other treatments like those drugs I just said, in the ER, in the hospital. So alcohol's effect on nausea and vomiting is promising for both possible therapy in the future, and this definitely is something that could be further looked at as a possible treatment. I'm sure a question for a lot of you is, what is the exact mechanism of action of alcohol, isopropyl alcohol, for nausea? And I think it's not been fully elucidated yet. It's not been fully revealed. So that would be an interesting topic to look at as well. So yeah, that would be the end of my presentation. So I hope you enjoyed. Thank you.